My name is Nat Levy. I'm the Director of Pulmonary and Critical Care at Progress West Healthcare Centre. We treat patients with pulmonary issues and patients that are admitted to the intensive care unit. I also see patients in the office dealing with sleep issues and sleep problems, and also general pulmonary problems that they may have. Sleep disordered breathing is one of the major disease processes that occur, and included in the sleep disordered breathing is a syndrome called obstructive sleep apnea syndrome. Now, obstructive sleep apnea syndrome occurs when patients are sleeping at night and the soft tissues in the upper airway collapse and cause an obstruction, so the patients have difficulty breathing during the night. One of the complications associated with this is that the oxygen concentrations drop. Sometimes the CO2 levels in the blood may rise, but it's these obstructive events that occur that cause all the complications and cause all the comorbidities associated with obstructive sleep apnea. Very often the patients are referred by the spouses whose sleep is really disturbed by the patient snoring at night. So snoring is one of the major symptoms. Often the patients awaken in the morning feeling drowsy and fatigued. Often they awaken with frontal headaches, and then that extends into their functioning during the day, where they have significant daytime hypersomnolence, where they sleep a lot during the day, they fall asleep. There's been many studies done that have shown an association of obstructive sleep apnea syndrome with diseases such as high blood pressure. It's not just a disease process that's associated with poor sleeping and maybe being fatigued or tired during the day. That's only one issue. The mainstay of therapy is CPAP therapy, which is a positive pressure which is delivered by a CPAP machine with a mask that the patient uses, either a nasal mask or a full face mask. There's many different kinds of masks that are available, and the patient puts this on, and the positive pressure that this machine delivers actually holds the airway open and prevents these events happening. Now, although I'm saying that CPAP therapy is the mainstay of therapy, in patients that have got mild disease, they can also get a dental device made for them, which is a special device that there's two kinds. The one would help with helping the mandible move forward, and then obviously expanding the space in the airway. And there's other ones that immobilize the tongue and prevent the tongue from obstructing the airway at night. Once the patients are set up with CPAP, it sometimes takes a little while to acclimate them to getting used to using the machine. But if they persevere and they continue to use it, they very often they come back and tell me how it's been a life-changing event for them. They've gone for years and years and years with being fatigued and sleepy, and then all of a sudden they get some treatment where they feel like a different person, which is very rewarding to treat somebody like that, and you see the difference it can really make. They've got more energy during the day, they're not falling asleep at work, they're not falling asleep driving.